Namaskar दोस्तों, good evening friends, and welcome to the 1144th episode of KK Med Talks. हम Baro Buddies वाली सीरीज में चल रहे हैं. Let's meet our Baro Buddy for today. Now, what is a Baro Buddy? We need to find out that as well. But first of all, let's introduce Mr. Diwakar Mittal. A warm welcome, Mittal sahab.
Thank you. Thank you very much, sir. Good evening to you and good evening, everyone.
Good evening. Diwakar ji, allow us to introduce you to everyone. पूरे इंडिया से बाहर से भी लोग logged in हैं listening to us. Mr. Mittal works as Senior Director of Corporate Affairs at Novo Nordisk India. More than 2.5 decades of experience in the healthcare industry, he has worked in pharmaceutical and medical device sectors, and he has been instrumental in creating many public health partnerships, many initiatives in non-communicable disease, both in type 1 and type 2 diabetes, but now also in obesity and in rare diseases. इनका जो स्पेशल इंटरेस्ट है वो है इम्प्रूविंग पेशेंट हेल्थ आउटकम्स, और जो एक खासियत है मित्तल साहब की कि माइक्रो लेवल पे तो काम करेंगे ही, जमीन पे जाके एट द ग्राउंड लेवल, बट ही इज इक्वली अडेप्ट एट मीजो एंड मैक्रो एंड मेगा लेवल इनिशिएटिव्स. तो चाहे बड़े पैमाने पे आपने काम कराना हो, चाहे छोटे पैमाने पे नजाकत वाली चीज देखनी हो, वेदर इट्स रिलेटेड टू एजुकेशन और टू मेडिकल केयर, हेल्थ केयर और टू हेल्थ केयर डिलीवरी, देन मिस्टर दिवाकर इज द गो टू पर्सन. एंड ही बिलीव्स इन बिल्डिंग फाउंडेशंस. तो यदि हमारी फाउंडेशंस स्ट्रांग होंगी, हमारी नींव ताकतवर होगी, तो ऑटोमेटिकली उसके ऊपर जो ढांचा है, जो रिजल्ट है, वो अच्छा बनेगा. सो सर, वार्म वेलकम वंस अगेन.
Thank you so much, sir. It's a personal pleasure. Thank you. बहुत बहुत धन्यवाद, sir.
People greeting you from across the country, and स्वप्ना जैन मैडम वेल्लोर से आपको ग्रीट कर रही हैं. ऑल्सो मिस्टर मान सिंह, जो डायबिटीज इंडस्ट्री में भी लीडर हैं अपनी जगह, वो चंडीगढ़ से आपको ग्रीट कर रहे हैं.
Thank you, sir. Yeah.
तो सर, एक अपने बारे में बताएंगे. नाउ यू आर हेड ऑफ कॉर्पोरेट अफेयर्स. दैट इज सच अ बिग थिंग. हमारा मुंह भरता है ये बोलते हुए. बट व्हाट अबाउट योर रूट्स? वर यू बोर्न इनटू कॉर्पोरेट, लेट अस से, prestige?
No, not at all, sir. Actually, in fact, I started in 1993 from an area which is very close to the place where you live in Karnal. So that's the reason when I'm talking in this forum, I have a little bit of personal relevance as well. So there's a small village. Now it has become a kind of a town called Chinjana, which is just 20 kilometers towards the Yamuna River, on the bank of Yamuna River. So I was born and brought up there. I studied there up till 12th. उसके बाद में मैंने ग्रेजुएशन किया सर अपना. फिर मैंने पोस्ट ग्रेजुएशन किया फिजिक्स में. और एक दो जनरल रूटीन रहता है कि ग्रेजुएशन, पोस्ट ग्रेजुएशन और उसके बाद में जॉब वगैरह कहीं करेंगे. But actually during my post graduation I was lucky enough to meet some amazing people, professors, which helped me to improve on the communication and how to talk, how to communicate. And then especially health, I got access to healthcare development. So this is how initial thinking came up, and then I became a medical representative in a pharmaceutical company. And then in fact I started my career from Karnal only, the city where you live. My first working was at Kunjpura Road, Karnal, where you have your clinic. So, and then slowly I grew up from sales position to manager to senior manager to leadership, and then different type of people started to coming in life who really influenced me in a very positive manner. Then from pharmaceutical I kind of moved into medical device sector. That changed my perspective more from the patient side, because in devices you end up working a bit more on the patient side, training them, educating them. I worked mostly in diabetes area, always in my career. And then later on in devices also, I had the pleasure of launching some of the unique devices in our country which are good enough for the people who are suffering, whether it is type 2 diabetes or type 1 diabetes or gestational diabetes or many different type of diabetes actually. So वहाँ पे काफ़ी learning हुआ सर, और काफ़ी घूमने को भी मिला, travel करने को भी मिला. I travel different locations. Delhi से I moved to Bombay. Bombay में I lived for about 12-13 years with different companies, different jobs. Patient support programs में काम करने का मौका मिला. So during that time, after spending about 15 years or so, I got exposed to public health, that how our work can have linkage to public health as well in terms of development. And within public health, especially at the primary care, because that's very important, and that's what my learning has been over the period of time. So I was lucky enough to work or to steer some of the projects, work on the grassroots, even in villages, and really see firsthand what are the challenges of our primary care in our country, and also what are the potential solutions to healthcare in general, especially non-communicable diseases. So that experience was really defining moment. Like for all of us, we have a phase where we get some experience, we get people who teach us, and that kind of becomes your true north, and where you like to drive your journey slowly, slowly in that direction. So there's a saying which I really believe, that what you are seeking is also seeking you. So in that manner, public health work, driving health as an equity, which is very much required, driving capacity building work, capability building work, doing projects around it, doing advocacy around that, and then role of media, which is again very, very important, especially in our country, how media can positively shape the narratives about healthcare. Those things started to happen, and then, to cut the long story short, that gave rise to what I'm doing right now in terms of really driving some of those very important narratives, whether it is diabetes or obesity, or even rare diseases in our country. So, a short story, but that's what my roots and my learnings have been always so far.
दैट इज नाइस सर। एक आपको गुड इवनिंग आ रहा है रेखा बटारा मैडम से। मुरसलीन नासिर जी आपको गुड इवनिंग कर रहे हैं, एंड विनायक शर्मा जी, बिमला कपूर मैडम भी नमस्ते कर रही हैं आपको। पर
Thank you,
ये
sir.
जिंजाना जो है, जिंजाना इज फेमस फॉर शुगर केन। तो
Yes.
शुगर केन से शुगर के इलाज पे ये वाला जो आपने इतने प्यार से, इतनी मिठास के साथ आपने ये अपना अपनी हिस्ट्री बताई कुछ ही मिनटों में, और इतने प्यार से बताई सर, इसमें दिक्कतें भी तो आई होंगी। एनी चैलेंजेस, डू यू रिमेंबर एनी मेजर चैलेंज दैट यू फेस्ड व्हेन परहैप्स यू आर अबाउट टू गिव अप, कि अब तो बस मैं वापस जाके गन्ने की खेती करूंगा और कुछ नहीं करूंगा? डज एनीथिंग कम?
Yes. Yes, sir. So actually, I personally myself come from a farming background. My father, who is no more, was a farmer. We still have lands in that area. So I fully. So of course, there have been a lot of challenges. One challenges was actually English speaking. That, because in that area, and especially in those days, it was not so regular for somebody to speak, and especially when you like to work in corporate sector, you have to be very well versed in your communication, because end of the day, the work which we do, we are in the business of communication, so we communicate better, we end up doing more. So that was one big challenge, and also thinking very differently, because generally pedigree has been कि engineer बन जाओ या doctor बन जाओ, especially in 90s. But getting into a very different job, which is a sales job, and then so मतलब फैमिली को भी मालूम नहीं था कि ये क्या होता है, प्रोफेशन कैसे होता है, मेडिसिन पे कैसे काम करते हैं, हाउ डू यू वर्क. So those were the kind of challenges, so to say. But then I realized, if you are determined within, and if you get the right people, right support, so then you end up working and you end up enjoying. And I was lucky enough to always get right people who supported me, whether even customers. So there were many, many doctors, endocrinologists who have been a big support in terms of motivating and working along. But yes, those are some of the initial challenges which I did face, and how to keep yourself relevant, and how to learn, how to show your learning agility, new things. For example, in last few years, we have seen digitalization coming in a big manner in our country, especially in healthcare, actually. But then how to learn that, how to pick that up, and then move it along with this and show, actual proofs. So those are also some of the challenges which later on became the opportunity, actually. Yeah.
सर आपकी तारीफ हो रही है फ्रॉम मिस्टर मान सिंह। जो खुद अपनी हिस्ट्री बताते हैं कि ही इज फॉलोइंग इन योर फुटस्टेप्स। अब वो चंडीगढ़ में काम करते हैं मल्टीनेशनल में, पर वैसे वो बुबका गांव से हैं, जो कि यमुना नदी के 20 किलोमीटर इस तरफ है, हरियाणा
Wow.
की तरफ। एंड ही सेज द सेम चैलेंजेस, वही चुनौतियां इंग्लिश बोलने वाली। पर आपसे जो उन्होंने सीखा है, वन इज डिटर्मिनेशन। अगर दृढ़ता हो तो ऑब्वियसली यू विल सक्सीड। एंड दूसरा देखो, मित्तल साहब ने क्या कहा कि आई वाज ऑलवेज लकी टू हैव पीपल हु हेल्प मी। बट देन उन्होंने ये भी कहा, जिस चीज की आपको तलाश है उस चीज की आपको भी होती है। तो इफ यू सर्च फॉर कोलैबोरेटर्स, इफ यू सर्च फॉर पीपल टू हेल्प यू, then
Yeah.
automatically you will find them. On the other hand, if you search for competitors, हमेशा आप गुस्से में या कॉम्पिटिटिव स्पिरिट में हो और सिर्फ आप इंडिविजुअलिज्म की तरह सोचते रहो या उसकी ओर सोचते रहो, तो आपको वही चीज दिखाई देगी। बाकी लोग भी जो टकरेंगे आपको, वो इंडिविजुअलिस्टिक होंगे, एंड देन यू विल नॉट बी एबल टू ग्रो। सर,
Yeah.
एक क्वेश्चन आ रहा है स्वप्ना जैन मैडम की तरफ से। मैडम की मदर टंग है मारवाड़ी, हिंदी बोलती हैं, तमिल बोलती हैं। अब उनकी फर्स्ट लैंग्वेज तमिल है, शी लिव्स इन सीएमसी वेलोर। तो वो पूछ रही हैं आपसे कि मित्तल सर, इंग्लिश सीखना ज्यादा मुश्किल था, ज्यादा कठिन था, या वेट कम करना ज्यादा मुश्किल है?
Actually, weight कम करना ज़्यादा difficult है, I would say, because then you are fighting with yourself, and you're on your own. But yes, I have some thoughts on that as well.
So see, when you want to learn English, let's say you want to learn Latin, अब मुझे संस्कृत लिखनी पढ़नी नहीं आती, मैं मूड बनाने की कोशिश कर रहा हूँ, पर अब मैं मूड बना ही लूंगा कि मैं संस्कृत प्रॉपर्ली सीखूं। तो
Yeah.
then you are just fighting cognition, and maybe you are fighting external limitations. You know, like you don't have a Sanskrit professor near you, या आप झंझाना या शामली में हैं, कोई और इंग्लिश बोलने वाला ही आपको नहीं मिलेगा, ना कॉलेज में, ना स्कूल में, ना घर पे। बट जब ओबेसिटी से हम लड़ते हैं, व्हेन वी ट्राई टू ओवरकम ओबेसिटी, वी आर फाइटिंग आवर ओन हार्मोन्स, आवर ओन न्यूरोट्रांसमीटर्स। आप अपने खिलाफ लड़ रहे हो। जबकि ओबेसिटी में आप बाहर की जबकि इंग्लिश सीखने के लिए आप बाहर की लिमिटेशंस के से लड़ रहे हो, जूझ रहे हो। तो ये जब हम अपने हार्मोन से लड़ाई करते हैं, तो उनके साथ भी एक चलने का तरीका होता है। सो मेनी ऑफ अस हैव दिस कंप्लेंट मिस्टर दिवाकर के, मैं तो वेट कम करने को तैयार हूं, बट जो एनवायरनमेंट है वो कंड्यूसिव नहीं है, गवर्नमेंट की जो नीतियां हैं वो कंड्यूसिव नहीं है। तो अजय यादव जी हैं, डॉक्टर अजय यादव इज अ वेरी रिनाउंड डायबिटोलॉजिस्ट फ्रॉम नेपाल। वो सर कह रहे हैं, एक तो गुड गोइंग सर, एंड कैन यू शेयर सम बेस्ट प्रैक्टिसेस, हाउ यू हैव हेल्प्ड शेप पब्लिक पॉलिसी, हाउ यू हैव हेल्प्ड our policy makers and planners understand the importance of diabetes and obesity?
Yeah. Yeah. Well, this is definitely a work in progress. But what we are seeing more and more, the focus is coming on non-communicable disease. What also we have seen, for example, when India became independent, we had the large, focus on communicable disease. So we had a lot of communicable disease at that time. But what we have seen, especially during Asiad Games, and then India opened up a little bit, and then we started having more and more economic changes in our country, so which gave rise to also more and more prosperity, and then of course then the non-communicable disease. So at the health system level, one of the insight which I got particularly is that there is a epidemiological transition which is happening in our country from communicable disease to non-communicable disease. So health system to same ही रहता है, so which has been dealing largely for communicable disease. Now it has to deal with non-communicable disease. So obviously this will lead to pressure because historically it is designed more from the communicable point of view. And in non-communicable disease, second learning which we have seen, the community approach is very important, a shared responsibility, because the disease pattern, or the narrative of disease is like that, where it needs to be co-owned by different people. And in that, what we are seeing is a more integrated care model, where focus of course is on medicine, but beyond medicine, in terms of really making sure people with these conditions are supported, are much more important. So from that point of view, the third learning which we have is the primary care plays or will play a very important role, especially when it comes to non-communicable disease. And strengthening of primary care is something which is very important, which I think is also coming in a big manner in terms of focus. And we are seeing initiatives coming in various states, even driven by central government also, where the focus is more and more on primary care. But again, as I said, the learning is there is a still focus on communicable part, while we have non-communicable disease going up. So health system strengthening at the primary care, I think, is one theme which is something very close to my heart, and which something is very important, as we go along and as we address the issues about non-communicable disease. And this is something which is my insight as well while working on various projects. Yeah.
Dr. Yadav points out that the same things are relevant for Nepal and other countries as well. We are all going through this epidemiological transition. तो सर अब ओबेसिटी की बात होती है. There are some people who say that obesity is a disease. We must prevent it. We must treat it before it causes other diseases. There are yet others who say that we are unnecessarily engaging in fear mongering or in medicalization of a normal thing. सब जो लोग ओबेसिटी के साथ रहते हैं वो तो खाते पीते घर के हैं, तो तुम्हें काहे की चिंता, तुम क्यों परेशान होते हो. एंड बीच में these are two ends of the spectrum, and बीच में हर तरह की हर भांति के opinions हैं. तो सर ये क्वेश्चन है कि when 2.5 decades ago you started trying to shape policy regarding diabetes, क्या क्या challenges आए, क्या क्या solutions आपने इजाद की, and how can we get lessons from that, how can we take learning or inspiration from that so that we can manage obesity in a more efficient and effective manner as compared to what we had done for diabetes 2 to 3 decades ago.
Yeah. So obviously, I think it's a very, very relevant point. But as I said in the beginning, our health system historically has been designed more for the communicable part. So one big challenge is to really activate and strengthen primary care from capacity and capability, both point of view. But the good thing is, India is also a country where we have a very large cadre of community health worker. We call them ASHAs, accredited social health activists, who have done phenomenal work on various communicable diseases, whether it is TB or polio or many other mother and child, many of those things. And I think one such learning on one such potential solution moving forward is to really strengthen this cadre of people, especially when we are dealing with, let's say, diabetes or even obesity. Because obesity is not just at the upper segment of the strata. We are seeing, especially in our country, obesity even in rural areas. I mean, we know the thin fat Indian concept, where you may have a low BMI, but you still have the obesity per se. So what we are seeing is one key learning: the strengthening of community health worker, or bringing things like diabetes or obesity, especially from prevention point of view, on their agenda, is potentially a very, very good advocacy and a potential policy shaping work, which can really be very, very beneficial for our country. I also want to mention within diabetes, especially type 1 diabetes, because we are seeing almost 300,000 cases of type 1 below 18 years in our country. And we see type 1 because it's not a lifestyle problem. The spread of type 1 from Kashmir to Kanyakumari is symmetric in nature. And we see more type 1 on the countryside because large part of India is still into rural areas. So if we strengthen primary care, then type 1 can also be taken care of from early diagnosis, from treatment and those kind of thing, catch them early kind of approach so that they get the treatment very early. So, and in fact, even in rare diseases, things like sickle cell, which is also not so rare in our country from a number point of view, and we see that quite a lot, especially in tribal population. Again, primary care or involvement of community health worker could be really, really powerful tool. So to answer this, and based on my own insights of working on various projects, and we continue to drive, I think primary care and especially the community health worker, involving them could be one potential tool or one potential solution as we address some of these challenges moving forward. Yeah, and that has been my learning so far, actually.
Thank you. And Dr. Ajay continues the conversation. वो कहते हैं कि in school going children, obesity is the new pandemic. जैसे आपने कहा catch them early, catch them young. And you've also spoken about the आशा workers. ऐसे ही गवर्नमेंट की स्कीम्स हैं, किशोर सेहत, बाल सेहत. So these schemes are there. But this is specifically, what would you suggest for all our listeners? How do we reduce the screen time in children? ये एक new addiction है.
Yeah, well, it's a very very relevant and very important part. In fact, obesity, especially among school children or among adolescent, is been a very very big growing problem. And actually, in the initial part of this, what we see, these kids who are chubby, they like it, and when they grow with this, they never lose weight. They continue to have obesity. In fact, I have been fortunate enough to get involved in one project where we focused on school health, where we focused on teachers, their education, kids' education, and also the parents, their education, in a very simple manner, so that they know about what do we mean by, let's say, type 1 diabetes, or what do we mean by childhood obesity. And we could see the community activation around school as a one powerful tool in terms of, for example, canteen food getting changed within those schools. For example, we have more and more, these cafeterias and these kind of shops outside the school. When there's a racist, kids go out and they jump onto them. Maybe some policies around in terms of moving them a bit away. And we have seen, especially in Europe or in Canada, there are policies where you can't have a fast food center at a certain distance to a school. Those kind of policies are there. So those are again opportunity for us to really implement this. And the good thing, what we have seen, something called reverse education, where kids who are getting educated in the school and who are the brighter ones, they end up educating their parents as well. We call it reverse education, in terms of that this is good food, this is not good food, this is diabetes, this is obesity. And that education, which is in, not instruction based, it is more influence based, is much more powerful even for the parents. So those are some of the learnings. Hence, school today, in my view, are very important area where such education can happen. I remember when I was in the school, एक सब्जेक्ट होता था नैतिक शिक्षा, और नैतिक शिक्षा का पूरा पेपर होता था, पूरा सब्जेक्ट होता था जिसमें ये सब चीजें आती थी. So and getting health in those is one very powerful tool, even in villages, because we do have midday meal which has been given. And how do you improve the quality? The millets in that midday meal are again some of the very important areas to be addressed. Hence, school becomes a very powerful, a location to do such education, especially on childhood obesity and even on type 1 diabetes, actually.
Sir, Rian Yadav hai, who is a very smart and handsome boy in class 5. He is from Nepal. And he asked, sir, आप class 5 में नैतिक शिक्षा में पास हो गए थे क्या?
Yes, पास में हो गया था.
Because Rian is feeling very lucky that he doesn't have to study नैतिक शिक्षा. Otherwise, गड़बड़ हो जाती है. और हमारा हिंदी में भी हाथ तंग है. But see, we have learned so much from Mr. Mittal sir, na? Dekho, so much of determination, and he has been able to rise above his limitations. And what we hear from is number one, determination, drirta, perseverance. And the second is teamwork. You go out, you keep an open mind and you find the team. And एक और चीज जो हमने सीखी, you keep on learning. तो जैसे उन्होंने कहा न्यू challenges आए, तो न्यू पढ़ाई करनी शुरू की. I am reminded of this concept of digitalization. जब मैं student था, when I was a student, when I was doing MD, digitalization meant admitting a patient with heart failure, giving digoxin, quarter tablet, half tablet, three-quarter tablet. So digitalization meant that gradually you increase the dose of digoxin until the patient reaches the right dose. And now digitalization means something totally different, that is related to not at all to digoxin. That drug is not used anymore now, but now it's related to things like what we are doing now. Now this is digitalization of information and knowledge sharing that we are doing. स्वप्ना जैन मैडम सर रिस्पॉन्ड कर रही हैं आपको। वो कहती हैं कि आई डिड माय स्कूलिंग इन द स्टेट बोर्ड, एट माय वर्क प्लेस आई स्पीक तमिल, एट होम आई स्पीक मारवाड़ी, एंड आपसे मैं बहुत इंस्पायर हुई हूँ, एंड नाउ आई विल इम्प्रूव माय स्पोकन इंग्लिश एज वेल।
Thank you.
Madam is
Amazing.
an advocate for obesity, and she was our first Barobuddy in our Barobuddy series.
Oh,
तो
wow.
सर लास्ट क्वेश्चन अगर आप इजाजत दें, हमारी
Mm.
थीम चल रही है बैरोबडीज। तो
Yeah.
सर व्हाट डज द वर्ड बैरोबडी मीन टू यू, ये पहला सवाल। और दूसरा, हाउ कैन वी बिकम ईच अदर्स बैरोबडीज? हम सब
Yeah.
एक दूसरे की, नेपाल इंडिया सब लोग, हाउ कैन वी सॉर्ट ऑफ help each other uh, achieve and then maintain a healthier weight?
Yeah. No, so I think that's a very relevant point close to my heart. And I may sound a bit philosophical over here, but I would love to share my thoughts. So, what I've seen is we human being, in true sense, we coexist. You see, I personally believe, and I've seen it in my life so far, that idea is not to run fast. Idea is also to run far. Hence, hence this co-creation or this kind of understanding each other, and really creating that environment which is collaborative. I think is something which is very natural for human being. Hence, this concept of buddies becomes very important because we can learn from each other. We can walk the path because we all are born with a mission in life, not just dreams which are given to us by society. And idea is to really fulfill that mission which we are born for, which is to really work for bigger causes. And let's say in this case, in this call which we're talking is the healthcare, bringing, developing, and really accelerating healthcare in our country, which is so very important actually, because it is proven again and again that health is the only wealth which actually we have. I mean, we may have thousands of issues, but the moment we have health as an issue, then we only have one issue, which is health. So I think from that point of view, this whole co-creation, this working together, this creating this kind of a understanding that we coexist, I think is something critical. And this where, to my mind, because I do see your programs sir, very regularly, this concept of Barobuddy, especially from healthcare point of view, I think sir, is very very important. We all have strengths. We also have our weaknesses. But idea is not to make weakness our strength. Idea is to really strengthen our strength and have weakness not to come in our way in a manner actually. So and in that process, I think people can support. Second part, which I have learned, as I said in my discussion so far, is this whole community-based work, especially in healthcare, is very very powerful actually, like the team-based work. And in fact, I was lucky enough to study public health a little bit in UK, and where I learned firsthand that how the team-based work, even at the medicine level or at the public health level, is so very important, which is kind of practiced over there. So I think from that point of view, this buddiness, this working together, plays a very important role to deliver a certain outcome. So these are some of my thoughts. And sir, I must congratulate you, Dr. Kalra, because you are driving this in a very very nice and very different manner. And I always listen to your talks. So thank you and congratulations to you.
थैंक यू। सर एक लास्ट क्वेश्चन फिर से आ रहा है, अगर आप इजाजत दें। ये
जी,
चंडीगढ़ से है, एंड मिस्टर मान सिंह कहते हैं कि सर लाइक यू सेड टीम वर्क इज रिक्वायर्ड, सो वी नीड टीम वर्क एट द लेवल ऑफ द फैमिली, एट द लेवल ऑफ द कम्युनिटी, एट द लेवल ऑफ द कंट्री एज वेल। एंड नॉट ओनली दैट, यू नीड टीम वर्क विद द हेल्थ केयर प्रोफेशनल, मतलब आपस में ना लड़ें, एक दूसरे के साथ इकट्ठे मिलके आप ओबेसिटी से लड़ें। तो ही सेज आई हैव अ चैलेंज, हाउ डू आई कीप माय फैमिली मेंबर मोटिवेटेड? My family member, she recently lost weight with modern medicines, then discontinued for whatever reason. Now, how do I motivate her to follow a healthy lifestyle and diet? Any suggestions?
yeah. Well, in fact, what I've seen is because I'm also on my journey as far as obesity is concerned. Actually, our own motivation sometimes is more important to for us to motivate, especially in the family. So, for example, I've really started following personally a very strict schedule, diet, exercise, all those things. And depending upon that, I'm many time I'm able to see that I'm able to influence my family members. And I live far away from my family member. I live here in Bangalore, and they are still in Jinjana. But I connect with them, and they see my motivation, and even my friends also. So I think, to answer your question, my perspective is, for us to motivate others, first we have to get motivated. First we have to show consistency. First we have to show our own actual proof, our own authenticity about what we are doing. And there may be, in between, some issues here and there, but in intermediate to longer term, people are really able to understand our character and our being, and they start following and they start agreeing what we are because we are saying for overall benefit. Actually, that's what I try to kind of follow, and that's what I personally believe.
We have a comment, sir. Actually, thank you from Dr. Samir Zargar, who works in the obesity space in Malaysia, and also from Mr. Rohit Lunawat, जो कि एक्सपर्ट हैं अब डिजिटल कोलैबोरेशन एंड कंज्यूमर मार्केटिंग के. तो वो कहते हैं मिस्टर लुनावत कि उनका भी एक चैलेंज है, हाउ टू यूज द डिजिटल स्पेस टू to create awareness about obesity management, and this Barobuddies is a nice way. Actually, it's a very friendly way of achieving that.
Yeah, exactly, sir. Exactly. Yeah.
विजय सर, फिर से आपको शुक्रिया, धन्यवाद, मेहरबानी कहेंगे फॉर स्पेयरिंग टाइम फॉर अस. वी एप्रिशिएट योर एक्सपर्टीज, योर एजुकेशन, एंड वी एप्रिशिएट स्पेशली द टाइम दैट यू हैव स्पेयर्ड फॉर अस. तो एक जो चीज़ हमें जो अच्छी लगी कि हालांकि आप डायरेक्टर हैं कॉर्पोरेट अफेयर्स के, तो भी आप बिल्कुल ग्राउंडेड हैं और आप हमसे इतनी सरल भाषा में, इतने सिंपल वे में आप बात कर रहे हैं, एंड यू हैव पुट योर वेज फॉरवर्ड इन सच अ सिंपल वे. हमें वो एक्चुअली बैरोबडी वाली फीलिंग आ रही है, टीम वाली
Thank
फीलिंग
you,
आ रही
sir.
है.
Thank you, sir. Thank you so much, sir. Same here, sir. Thank you. Really appreciate.
शुक्रिया, शुक्रिया बहुत-बहुत. जैसे कि हम हमेशा कंक्लूड करते हैं, थारा भला हो, सबका भला हो, एंड जय हिंद.
Jai Hind.